Pearl, faculty member here at the Center for Simulation. One of our goals here at the center, commonly known as the SimLab, is to create an environment that's very similar to the inpatient experience that students will have when they go to their clinical. Now, in order to help us with that goal, we've created something called the Simulated Hospital Day. That's where student nurses take care of student patients for a period of time. Now, in order to provide effective, safe, appropriate care, the student nurse is going to have to access supplies and materials to take care of the patient. So what I'm going to do right now is walk you through the process to show you what resources are available and how to locate those supplies. Okay, you ready? Let's get started. I've taken the initial assessment on my patient, I've graded her, and I've determined that my patient is at risk for falls. But I noticed that the patient didn't have a wristband that identified her. So, where would I get that? Inside each lab during hospital day is a white binder that looks like this. On the cover of the white binder is a table of contents. If you look at the table of contents, one of the things that's listed are patient wristbands. So let's look inside and see what those are. Sure enough, here's a yellow wristband that identifies patients who are at risk for fall. So I can take out the yellow wristband from my patient and walk it over to the patient's bedside. So at this point, I'm going to take my yellow fall bracelet and go ahead and put it on my patient, and I'll meet you back here in a couple of minutes. Okay, I'm back. At this point, I'm going to go ahead and do AM care for my patients. There's a folder in each one of the rooms. Inside this folder, it will tell you where different supplies are located. So let's take a look inside the folder. There's a sheet in this folder. And the sheet shows me that there's some supplies located at the bedside. So let's walk over to the bedside and see exactly what's at the bedside cabinet there. Bedside. And these are also conveniently labeled. Alright, so according to this, the top drawer should have my emesis basin, which I'm going to need for oral care. The second drawer should have my wash basin, which I'm also going to need. And just in case, the third drawer, the bottom drawer, has a bedpan and a urinal. So I've got everything I need right there for that. But you know what? There's other things I'm going to need to provide a bed bath and oral care to my patient. So I'll need additional supplies. I'm going to have to change the linen and get my patient a fresh gown. So let me see. According to this sheet in the folder, there's a supply closet in the room. And in the supply closet, I can actually find the remaining items I need to provide AM care for my patient. So let's walk over to the supply closet and see if they're there. Okay, so here we go. Here's my supply closet. Alrighty. Now, my diagram labels everything that's found on each of the shelves. Now, according to my diagram, on the second shelf, I should be able to find my AM supply care supplies and also my oral supplies. So I'm going to go ahead and gather everything I need, provide AM care to my patient, and then I'll meet you back here when I'm done. Okay, I've completed my patient's AM care, and I happen to notice that my patient's peripheral IV is older than 72 hours, which means I need to do an IV site change. So, let me see. I'm going to need materials to do an IV. I noticed that in the folder there are no materials in the room in the supply closet for IVs, but there is an IV closet out in the hallway. So let's take a walk down there, and I'm pretty sure I can find everything I need to start the patient's IV. Closet. So everything I need to start the patient's IV will be in here. There's IV start kits, there's IV catheters, bags of fluid, now and primary and secondary tubing. So let me go ahead and get everything I need to start this IV. I'm going to need a start kit, a catheter, I need some primary tubing, and my patient has an order for D5.5. So let me get a bag of fluid and make sure it's not expired, and I'm good to go. So I'm going to go ahead and start this IV. Let's go back to the lab. Okay, I'm almost ready to start. I do need to label my IV tubing, so you'll find during your simulated hospital day some labels that you can do that with. Make sure you pick the appropriate day. Go to my patient's bedside, start the IV, and as soon as I get done, I'll meet you back here and we'll continue our walk today. Okay, so I've completed the IV. While I was starting the IV, my patient developed a little shortness of breath. So I elevated the head of the bed, and I also know she has an order for a nasal cannula as needed. So I need to find a nasal cannula. There is an oxygen closet in the hallway next to the IV closet. So let's take a walk out there, and I'm pretty sure I can find my nasal cannula. Okay, so I've located the respiratory closet. Within this closet is everything you could possibly need to meet the respiratory needs of your patient. And right here are my nasal cannulas. So I'm going to take a nasal cannula. I'm also looking at what's in here, and I think what I'm going to do is take a Yanker suction and maybe even a suction kit, because I can kind of anticipate my patient needing these. Okay, so we have our supplies, and let's go ahead and go back to the bedside. So here I am at the bedside. Mrs. Clark, I've brought a nasal cannula. I think that's going to help with your breathing issues right now. So I want you to pay attention to the headboard up here over the patient's headboard. We have an oxygen regulator, and if you listen carefully, you can hear the compressed air. So our students actually get to experience what it's like to use the real equipment. So what we're going to do here is we can go ahead and attach the tubing to the oxygen regulator and turn it on to the appropriate liters per minute, and go ahead and they can go ahead and apply this appropriately to the patient. So that's the setup at the headboard. Let's go ahead and meet back at our starting place, and we'll continue on. Okay, I've done my documentation. My patient is feeling much better. One of my colleagues has asked me for some assistance working with their patient. Now the thing about her patient is the patient's in contact isolation. So I'm going to have to get some appropriate personal protective equipment. Again, referring to my folder, let me see. Now, according to the folder, there should be, all the PPE equipment I need should be in the area above the sink. So let's take a walk over to the sink and see if it's there. Okay, so here we are at the sink area. Now, according to my diagram, I'm definitely going to need an isolation gown. It should be located right here. Let's see. There they are. So here's my isolation gowns. Now the patient's in contact isolation, so I don't necessarily need to mask up or put on goggles or put on a bonnet. But if I did, according to this diagram, those supplies should be right here, and they are. Okay? So I'm just going to go ahead and get the supplies I need. I'm going to help my colleague, and I'll be back. Okay, so in addition to the medical supplies and equipment we've already found by looking through the folder, there are some larger pieces in each lab. These include things like wheelchairs, there's a cardiac chair, privacy screen, a walker, there's also a biohazard garbage can, a linen hamper, and a standing scale, as well as a bedside commode. So that pretty much covers most of the supplies and equipment you'll need. Thanks for taking this walk with me through medical supplies and equipment during the simulated hospital day, and I hope you have a good experience.